Did you know that the way you brush your teeth every single day could be quietly harming your heart? If you're over 60, a simple mistake in your daily dental routine might be triggering inflammation, clogged arteries, and even increasing your risk of heart attack without you ever noticing. Today, I want to reveal the #1 dental mistake seniors make and show you exactly how to fix it, so you can protect your heart, your energy, and your independence. When you think about heart health, you probably picture checking your blood pressure, watching your cholesterol, controlling your blood sugar, and maybe keeping an eye on your weight. And yes, all of those things are important. But here's the part that almost nobody talks about. Your mouth is the gateway to your entire body. The health of your teeth, gums, and even the way you care for dentures can send signals directly to your heart. Every small action or inaction can affect inflammation, blood flow, and arterial health. Let's start with a simple scenario. Imagine it's late at night. You're tired from the day, maybe watching a little TV, and you think, I'll just skip brushing tonight. I'll do it in the morning. That's an easy choice, right? It seems harmless. But what you don't see is what happens inside your mouth while you sleep. Every leftover crumb, every particle of food stuck between your teeth becomes a feast for bacteria. These bacteria multiply quickly in the darkness of your mouth, release acids and toxins, and irritate your gums. By morning, your mouth might taste funny, your teeth might feel sticky, and you might think, just rinse and I'll be fine. But inside your bloodstream, your immune system is responding to this bacterial invasion. Chemicals are released, inflammation spreads, and your heart silently absorbs the stress. One of the most common mistakes seniors make is brushing too aggressively. Many people believe that the harder they scrub, the cleaner their teeth will be. But the truth is the opposite. Brushing hard with a stiff toothbrush actually wears down the protective enamel on your teeth and irritates your gums. Irritated gums pull back slightly, creating tiny pockets where bacteria can hide. Once bacteria reach your bloodstream, they trigger inflammation, and that inflammation has a direct effect on your arteries and your heart. A soft bristled brush, held gently at a 45-degree angle to your gums, is all you need. Think of it like massaging a baby's scalp, gentle, loving, and consistent. Your gums heal, inflammation is reduced, and your heart is protected. Now, let's talk about bleeding gums. So many seniors ignore it, thinking that a little blood when brushing or flossing is normal. Some blame themselves for brushing too hard, and others just assume it comes with age. But the truth is that bleeding gums are often the first sign of gum disease, and gum disease is strongly linked to heart problems. The bacteria that cause your gums to bleed have been found inside the arteries of people who suffered heart attacks. Ignoring bleeding gums is like ignoring a fire alarm. Every day that passes is another opportunity for bacteria to enter your bloodstream and quietly harm your heart. Flossing is another habit that is often skipped, even by people who brush faithfully. Brushing alone cleans about 60% of your teeth, but the remaining 40%, the spaces between your teeth, is where bacteria love to hide. When you don't floss, you are leaving these bacteria undisturbed, free to multiply, inflame your gums, and eventually travel to your heart. Flossing daily, even if it causes initial discomfort, is one of the most powerful things you can do to protect your heart. Each floss between your teeth is a small step toward reducing inflammation and keeping your arteries healthier. Many seniors also rely heavily on sugary mints or cough drops throughout the day. Perhaps your medications cause dry mouth and you're worried about bad breath. It seems harmless, right? But sugar feeds bacteria, acids erode enamel, gums become irritated, and inflammation rises. Over time, this cycle can quietly increase your risk for heart disease. The solution is simple: switch to sugar-free mints or xylitol-based alternatives and make hydration a priority. Drinking water regularly not only helps wash away bacteria, but also keeps your mouth healthy and your heart safe. Dry mouth itself is another silent enemy. Saliva isn't just water, it's a natural defense system. It washes away food, neutralizes acids, and contains antibacterial properties. Many medications seniors take, whether for blood pressure, cholesterol, sleep, or pain, reduce saliva flow, leaving the mouth dry and bacteria thriving. If your mouth feels sticky or dry, or if you wake up thirsty at night, it's time to take action. Drinking water throughout the day, chewing sugar-free gum, and using saliva substitutes are simple ways to keep your mouth moist and your heart protected. Skipping dental visits is perhaps the most overlooked mistake of all. Many seniors think, "I've had these teeth for decades. I'll just manage." Some fear the dentist, and others worry about cost. But routine dental visits do more than clean teeth. They detect early signs of gum disease, oral infections, and even oral cancers that can spread to the heart. A simple checkup twice a year could literally save your life. Your dentist is not just protecting your teeth, they are protecting your heart. Let's bring this to life with a story. Mary, a 68-year-old grandmother in Ohio, brushed her teeth hard for decades, skipped flossing, and ignored bleeding gums, thinking it was normal for her age. One day, during a routine dental visit, her dentist explained that these habits were silently affecting her heart. She started brushing gently, flossing daily, drinking more water, and keeping up with regular dental visits. Within a few months, Mary noticed her gums stopped bleeding, her breath was fresher, and her heart risk factors improved. Small daily actions made a huge difference in her life. Then there's Robert, a retired firefighter from Texas. His medications caused dry mouth, and he relied on sugary mints throughout the day. He had no idea that the sugar was feeding bacteria that could affect his heart. After switching to sugar-free alternatives, drinking more water, and using a saliva substitute, he noticed better energy, fresher breath, and improved heart health. These stories show that even small, seemingly insignificant changes in daily oral care can have a dramatic impact on your overall health. Seniors often underestimate the power of small habits. Skipping a night of brushing, ignoring flossing, relying on sugar, or avoiding dental visits might feel minor, but the effects compound over months and years. By taking control of your oral health, you are taking control of your heart, your energy, and your independence. Now, imagine the next 10 years. You could continue ignoring these habits, and the silent damage could continue to build. Or you could make small, mindful changes today. Gentle brushing at night, daily flossing, staying hydrated using sugar-free alternatives, addressing dry mouth, and visiting your dentist regularly are small steps that protect your gums, reduce inflammation, and lower the risk of heart attacks and strokes. Each step you take strengthens your heart, improves energy, and supports independence. Remember, these changes don't require expensive tools or complicated routines. 2 minutes of gentle brushing, a few minutes of flossing, sipping water throughout the day, and regular dental visits are enough. Your mouth and heart are connected in ways most seniors never realize, and every small choice you make has a cumulative impact on your overall health. Tonight, when you pick up your toothbrush, remember that you're not just cleaning your teeth, you're protecting your heart. Gentle brushing, careful flossing, hydration, and regular dental checkups are investments in your life, energy, and independence. The small steps you take today will add up to a longer, healthier, and more confident life. Now that we understand how our daily dental habits silently impact our heart, it's time to focus on the specific actions that are causing the most harm. These are habits many seniors do every single day without realizing the danger they pose. If you're over 60, these 7 common dental mistakes could be quietly increasing your risk of heart disease, clogged arteries, and inflammation. But the good news is, once you know about them, they are entirely fixable. Let's start with the first habit, brushing too hard. Many seniors believe that scrubbing their teeth with all their might will remove more plaque. It feels productive, and sometimes it even feels satisfying, as if a stronger scrub equals a cleaner mouth. But the reality is very different. Brushing aggressively actually wears down your enamel, the protective layer on your teeth, and irritates your gums. When gums are irritated, they pull back slightly, creating tiny pockets where bacteria love to hide. Those bacteria can then enter your bloodstream, causing inflammation that travels directly to your arteries and heart. This is not just about your teeth, it's about your entire cardiovascular system. The solution is surprisingly simple. Use a soft, bristled toothbrush and hold it at a 45-degree angle to your gums. Brush gently, letting the bristles do the work. Think of it like massaging a newborn's scalp, slow, gentle, and careful. Your gums will thank you, your enamel will stay protected, and your heart will face less stress. This small adjustment in technique can make a dramatic difference over months and years. The second habit is skipping nighttime brushing. It seems harmless, especially if you brushed in the morning. Maybe you're tired or you think it's just one night. It won't matter. But the truth is, skipping brushing before bed gives bacteria a free all-night buffet. They feed on leftover food particles stuck between your teeth, multiply rapidly, and release toxins that irritate your gums. By morning, your teeth might feel coated with plaque and your mouth might taste unpleasant, but inside your bloodstream, your immune system is responding to this bacterial invasion. Over time, this repeated overnight bacterial growth triggers chronic inflammation, weakens your arteries, and increases the risk of heart attack or stroke. Brushing before bed isn't just about fresh breath. It's a vital step in protecting your heart. The third habit is ignoring bleeding gums. Many seniors think it's normal for gums to bleed, blaming themselves for brushing too hard or simply assuming it comes with age. But bleeding gums are actually an early warning sign of gum disease, and gum disease is strongly linked to heart problems. The bacteria that cause your gums to bleed have been found inside the arteries of people who suffered heart attacks. When your gums bleed, it's your body's way of signaling that bacteria are entering your bloodstream and causing inflammation. Ignoring bleeding gums is like ignoring a fire alarm. The fix is straightforward: floss daily, even if it causes temporary discomfort, and visit your dentist. Over time, your gums will heal, bleeding will stop, and your heart will be safer. The fourth habit is skipping flossing altogether. Brushing alone cleans only about 60% of your tooth surfaces. The remaining 40%, the spaces between your teeth, is where bacteria thrive. When you don't floss, you leave these bacteria undisturbed, free to inflame your gums and enter your bloodstream. Studies consistently show that seniors who floss daily not only have healthier mouths, but also lower risks of heart disease. Flossing doesn't have to be complicated. Take it slow, work the floss gently between each tooth, and think of it as cleaning the hidden hallways where bacteria might plot against your heart. The fifth habit is relying too heavily on sugary mints or cough drops. Many seniors do this to combat dry mouth or maintain fresh breath, especially if medications leave their mouths dry. But sugar feeds bacteria, which produce acids that erode enamel and irritate gums. This irritation triggers inflammation that can travel to your arteries. Over time, sugary habits silently increase your risk for heart complications. The solution is simple. Switch to sugar-free mints or xylitol-based products and sip water regularly throughout the day. Hydration keeps bacteria under control, protects your gums, and supports your heart. The sixth habit is ignoring dry mouth. Saliva is your mouth's natural defense. It washes away food particles, neutralizes acids, and contains antibacterial compounds that protect your teeth and gums. Many medications seniors take, whether for blood pressure, cholesterol, sleep, or pain, reduce saliva flow. A dry mouth creates the perfect environment for bacteria to thrive, which can lead to gum disease and increase heart risks. If your mouth often feels sticky, dry, or uncomfortable, it's time to take action. Drink water frequently, chew sugar-free gum, and use saliva substitutes when necessary. Keeping your mouth moist is not just about comfort. It's a crucial step in protecting your heart. The seventh habit is skipping dental visits. Many seniors assume that because they've had their teeth for decades, everything is fine. Some fear dentists, others think checkups are expensive or inconvenient. But dental visits are more than cleanings, they're life-saving preventative care. Dentists detect early signs of gum disease, oral infections, and even oral cancers that can affect your heart. A routine visit twice a year could literally save your life. By maintaining regular dental appointments, you're not only protecting your teeth, you're protecting your heart. Now, let's make this more relatable with real-life examples. Take Mary, a 68-year-old grandmother from Ohio. For decades, she brushed hard, skipped flossing, and ignored bleeding gums, thinking it was normal for her age. One day, her dentist explained how these habits were silently affecting her heart. She started brushing gently, flossing daily, drinking more water, and keeping regular dental visits. Within a few months, her gums healed, her breath improved, and her heart risk markers decreased. This demonstrates how small, mindful changes can have life-changing results. Then there's Robert, a retired firefighter from Texas. He relied heavily on sugary mints to manage dry mouth caused by medications. He had no idea that sugar was feeding bacteria that could affect his heart. After switching to sugar-free alternatives, drinking water throughout the day, and using saliva substitutes, Robert noticed better energy, fresher breath, and improved heart health. These stories show that even small, seemingly insignificant changes in your daily dental habits can dramatically improve your overall health. Gentle brushing, flossing, hydration, avoiding sugar, addressing dry mouth, and regular dental visits all contribute to stronger gums and a healthier heart. Seniors often underestimate the cumulative power of small habits. Skipping a night of brushing, ignoring flossing, relying on sugar, or avoiding dental visits may seem minor, but over months and years, the effects can be profound. By taking control of your oral health, you are taking control of your heart, your energy, and your independence. Picture this: two seniors side by side. One continues skipping flossing, brushing aggressively, relying on sugary mints, and avoiding the dentist. The other adopts gentle brushing, nightly brushing, daily flossing, sugar-free alternatives, hydration, and regular dental checkups. The difference isn't just in their mouths. It's in their arteries, their heart health, their energy, and their independence. Small daily actions accumulate into long-term benefits that can dramatically alter quality of life. By now, it should be clear that these 7 habits, brushing too hard, skipping nighttime brushing, ignoring bleeding gums, skipping flossing, relying on sugar, ignoring dry mouth, and skipping dental visits, are silently harming seniors' hearts every day. But the solution is just as clear. Small, deliberate steps can reverse the damage and protect your heart for years to come. The key is awareness. Recognize the habits that may be harming your heart and replace them with better choices. Brush gently, brush nightly, floss daily, avoid sugar, hydrate, address dry mouth, and see your dentist regularly. Each of these small actions is a powerful investment in your heart, your energy, and your longevity. Now that we've discussed the 7 harmful dental habits that silently threaten your heart, it's time to focus on the solutions. The small, practical steps that can protect your gums, your teeth, and most importantly, your heart. These are not complicated routines or expensive procedures. They are simple, everyday choices that can dramatically improve your health, energy, and independence. Let's start with gentle brushing. Many seniors still believe that scrubbing harder means cleaner teeth, but the truth is exactly the opposite. A soft, bristled toothbrush is all you need. Hold it at a 45-degree angle to your gums and move in gentle, circular motions. Imagine you're massaging your gums, not scrubbing a dirty dish. 2 minutes is all it takes to remove plaque, protect your enamel, and reduce gum irritation. By brushing gently, you prevent the tiny pockets where bacteria hide, keeping your gums healthier and your heart safer. Next, never skip nighttime brushing. Brushing before bed is non-negotiable. Think of it as locking the front door to your home. If you leave the door open, intruders can enter freely. If you skip brushing, bacteria feed on leftover food, multiply overnight, and release toxins that inflame your gums and bloodstream. By brushing nightly, you're not just protecting your smile, you're giving your heart a shield against inflammation and bacterial attack. Flossing daily is equally important. Brushing alone cleans only about 60% of your tooth surfaces. Floss reaches the hidden 40%. The spaces between your teeth where bacteria thrive. If flossing feels uncomfortable at first, don't give up. Start slowly and gently, working the floss between each tooth. Over time, your gums will adjust, bleeding will stop, and you'll be closing the door on bacteria that could otherwise reach your heart. Remember, every time you floss, you are actively reducing inflammation and protecting your cardiovascular system. Another simple change is reducing sugar intake in mints and cough drops. Many seniors use sugary products to combat dry mouth or maintain fresh breath, but sugar feeds bacteria and creates acids that harm enamel and gums. Switch to sugar-free alternatives or xylitol-based products. Sip water regularly to rinse away any lingering particles and support saliva flow. Hydration alone is a powerful defense against bacteria, helping your mouth and heart stay healthy. Addressing dry mouth is another critical step. Saliva is your mouth's natural defense. It washes away food, neutralizes acids, and contains antibacterial properties. Medications can reduce saliva flow, leaving bacteria to thrive. If your mouth feels dry or sticky, take action. Drink water throughout the day, chew sugar-free gum, or use saliva substitutes. These small steps keep your mouth moist, reduce bacterial growth, and protect your heart from inflammation and infection. Regular dental visits are not optional. They are essential. Twice-yearly checkups can detect early signs of gum disease, oral infections, and even oral cancers that could affect your heart. Your dentist is not just protecting your teeth, they're protecting your heart, your health, and your longevity. If cost or fear has kept you from visiting, think of it as an investment in years of independence, energy, and peace of mind. Let's talk about how to build these habits into your daily life so they become automatic. Start by setting reminders for brushing and flossing, especially at night. Keep a soft, bristled toothbrush and floss in your bathroom where you see them daily. Make hydration a habit by keeping a water bottle nearby throughout the day. Swap sugary mints for sugar-free alternatives, and take note of any dry mouth symptoms so you can address them immediately. And of course, schedule your dental checkups in advance. Treat them like essential appointments, not optional errands. Storytelling helps make this real. Take Joan, a 70-year-old retired school teacher from California. For years, she brushed hard, skipped flossing, and relied on sugary mints. She thought everything was fine until she learned that her gums were inflamed and that bacteria from her mouth could be affecting her heart. Joan decided to make small changes: gentle brushing at night, daily flossing, switching to sugar-free mints, hydrating more, and seeing her dentist regularly. Within 6 months, her gums healed, her energy improved, and her doctor noticed healthier heart markers. Joan's story shows that even small, consistent actions can have life-changing results. Then there's Harold, a 72-year-old veteran in Texas. Dry mouth caused by medications left his gums irritated and made him reach for sugary cough drops. After learning about the connection between oral health and heart health, he switched to sugar-free alternatives, hydrated consistently, and used a saliva substitute recommended by his dentist. Harold's gums healed, his heart risk markers improved, and he regained confidence in his daily life. Small, manageable changes transformed his health and his outlook. Building these habits also has emotional and social benefits. Fresh breath, healthy gums, and a bright smile increase confidence, making it easier to engage with friends, family, and community activities. Energy levels improve and independence is maintained. The benefits aren't just physical, they enhance your quality of life and help you enjoy your golden years to the fullest. Consistency is the key. Small actions, taken every day, compound over months and years. Gentle brushing, nightly brushing, flossing, sugar-free choices, hydration, dry mouth care, and dental visits are all steps toward a longer, healthier life. By focusing on daily routines, you prevent silent damage, reduce inflammation, and support your cardiovascular system. Let's break this down into a practical, daily schedule for seniors. Brush gently for 2 minutes before bed. Floss once a day, ideally at night. Drink water regularly. Avoid sugary mints. Use sugar-free or xylitol-based products. Chew sugar-free gum if dry mouth occurs. And schedule dentist visits twice a year. These 7 steps are easy to implement and maintain, yet their impact on heart and oral health is tremendous. Imagine combining these habits over the next year. Your gums become healthier, your teeth stronger, your mouth fresher, and your heart safer. Inflammation reduces, risk factors decrease, and you feel more energized and confident. This is not theory. It's proven by science and countless real-life examples. Every choice you make in your daily dental routine contributes directly to your overall well-being. Even if you've struggled with oral care in the past, it's never too late to start. Small, consistent changes can reverse damage and strengthen your heart. Gentle brushing today prevents pocket formation tomorrow. Flossing now stops bacterial buildup in the spaces between your teeth. Avoiding sugar and staying hydrated reduces bacterial growth and inflammation. Addressing dry mouth protects your mouth from bacterial invasion. Dental visits catch early signs before they become serious problems. Let's take a moment to visualize this. Picture yourself a year from now. Your gums are healthy, your teeth strong, your breath fresh, and your heart markers improved. You wake up with more energy, enjoy meals without discomfort, and smile confidently around family and friends. That future is entirely achievable with the steps we've discussed. It starts with small, deliberate actions every single day. Consistency and mindfulness are your allies. Don't let the busy pace of life or small excuses undermine your health. 2 minutes of gentle brushing, a few minutes of flossing, regular hydration, sugar-free choices, attention to dry mouth, and dental checkups are all that's required. The payoff is enormous: healthier gums, a safer heart, more energy, and prolonged independence. Every senior watching this video has the power to change their habits today. The link between oral health and heart health is undeniable. The steps are simple, but their impact is profound. Make gentle brushing a ritual, floss daily, avoid sugar, stay hydrated, manage dry mouth, and visit your dentist regularly. These are the small, consistent actions that protect your smile and your heart for years to come. Finally, remember this: your best years are still ahead. By taking control of your dental habits now, you're investing in your health, your energy, and your independence. Every small step matters. Every daily choice adds up. And the peace of mind that comes from knowing you're protecting your heart and your overall health is priceless. So tonight, when you pick up your toothbrush, think beyond your teeth. Think about your heart. Brush gently, floss carefully, stay hydrated, choose sugar-free alternatives, manage dry mouth, and keep your dental appointments. These are the steps that will help you stay strong, healthy, and independent well into your golden years. And if you found this video helpful, don't stop here. Come back to this channel, explore our other videos, and continue learning how to protect your health, strengthen your heart, and live your best life after 60. Your best years are ahead, and together, we'll make sure they are full of vitality, confidence, and independence.